Hello, I am Dr. Varsha Saxena, pediatrician at Anexas Clinic, HSR Layout and Muthanallur, Sarjapur. I am also a visiting consultant, Manipal Hospital, Sarjapur Road. So today I am here to discuss with you fever in children. So fever in children is the most common manifestations of diseases in children. And most parents panic at the sight of fever. But we should actually understand what is this fever all about? Whether it is a friend of the child or you should be worried about it too much. So actually fever is due to the immune response of the body, which it happens due to any infection which is entering the body. So when viruses or bacteria enter your child's body, the body produces antibodies against this. And the interaction of the virus, bacteria and the antibodies causes this metabolites and toxic products in the body which causes fever. So the fever is actually to know that the body is fighting the diseases in your children. But how to control this fever? Because sometimes this fever, if it is very high, can be dangerous. And parents should know it, how to control the fever in children. The first most important is to measure the temperature of the child. Sometimes a baby may feel warm to you, but he may not be having fever. So please measure the fever of the child with a thermometer. We prefer a digital thermometer. In small babies, you can try infrared thermometer, but sometimes the value may not be accurate. So digital thermometer in an armpit is a choice. And if the fever is more than 99.5 or 100 degrees centigrade, it means your child is having fever. So first of all, keep the child in a comfortable position. Don't overcover or overcloak the child in this situation. Because if you do that, the fever will increase more. The child is already hot. And if you are putting more clothes on the child, the body will become more hot. Especially the soles, the palm, there is no space for the body to get the heat out of the body. So keep light clothing. If the child is feeling cold, you can cover it with a blanket. He should be resting properly. The room will be well ventilated. It should not be very hot, neither too cold. Then comes the role of the fever medicines. So fever medicines, you should give the child paracetamol in adequate doses. You can see the last prescription given by a pediatrician and you can administer the dose of paracetamol. Do not wait for the child to eat something and give the paracetamol, because in fever the child may feel nausea, vomiting sensation, body ache and may not like to eat. In this situation, what happens? The fever keeps on increasing unless you give the paracetamol to the child. So give the paracetamol to the child and wait for the temperature to come down. Now, sometimes if the fever is very high, like 101, 104, the medicine will take some time to act in your body. The medicine has to go inside the body and act. That time, the fever may increase because the medicine effect has not come till now. So, the role of sponging is there at that time. So, sponging can be done with normal water. Normal water from the tap. It should not be cold water or ice pack. If the temperature of the water is cold, you can just make it lukewarm water and sponge it completely. Sponge the hands, the legs, the armpit, not only a strap on the forehead. And try to bring down the temperature with the medicine still try to act on the body. After 15 to 20 minutes of sponging, you will see the fever in the child is coming down. You can leave the sponging after that. But if the fever still not come down, many times paracetamol doesn't work and doesn't make the complete down of the temperature, we have to wait for 1.5 hours for the paracetamol to act. But if fever is not coming down after that, you can give IV to the child, which can be given in the adequate dosing. Or if the fever comes down and comes back very fast, you should not administer paracetamol again before 4 hours. So that time IV can be used in children. But we do not use IV in less than 6 months of child. The paracetamol can be given to the child every 4 to 6 hours depending on the temperature. But don't give more than 5 doses in a day. There is also a important role of hydration of the child. Most children will counteract the fever or viral fevers, but they may get dehydrated in this process. because when the fever is there, the body requirement of the water and liquids is much more than in normal time. So you should give adequate water in the child. When the fever comes down, try to feed the child with ORS, coconut water, juices, soup. If the child is not taking anything, this watermelon, cucumber, this high fluid contained foods can be given. So hydration of the child is very important. Most children will get admitted because of dehydration. So maintain the hydration of the child so that he can counter the fever. Now, what are the danger signs when you should worry about the child? So danger signs can be if there is fever in less than 3 months of child. It's always better to consult the doctor, especially if it is more than 100. If the fever is more than 104 and all repeated fever, too much shivering is there in the child, or if the fever lasts for more than 4 days in a child, better to consult the doctor. And if there are any rashes, red rashes, or the child is consistently vomiting, not accepting feed, dull, lethargic, neck rigidity, so in these conditions, better to consult with the doctor about the disease of the child. So in a nutshell, we can say that fever can be easily managed at home by parents in children. Children will get episodes of fever during initial phases of their life, and parents should know these steps to manage the fever at home adequately and consult the doctor at the time of emergencies. Thank you.